Hello, my friend. I want to start today with something I see almost every week in my clinic. An older woman comes in with her daughter. Her memory has been slipping. Names are harder. The car keys disappear. She has been on the same antihistamine for sleep for 15 years. She has been on bladder medication for 10. She has been on omeprazole for a stubborn case of reflux for almost as long. And when I look at her chart, I see something that does not feel like a coincidence. The most well-meaning prescription, the one we never thought twice about, has been silently bathing her brain in something her nerve cells were never designed to tolerate. That is not a rare story. That is the new normal. My name is Dr. Thomas Reynolds, and I have spent decades caring for older adults. I have watched thousands of people age. I have seen what quietly steals their minds, and I have seen what protects them. Today, I want to walk you through 9 popular medications that research has linked to an increased risk of dementia. Some of them are sitting in your medicine cabinet right now. Some are ones your mother takes. Some are ones you picked up on the advice of a well-meaning friend or a pharmacist 20 years ago. None of them are bad drugs when used in the right person, at the right dose, for the right length of time. The problem is that for older adults, the calculus changes. Your brain is different at 70 than it was at 40, and medications that felt harmless in midlife can leave a fingerprint on cognitive aging. I am not going to tell you to stop anything on your own. I am going to explain what the evidence is showing, why your nervous system reacts differently as you age, and how to have the most productive conversation possible with your prescriber. Let's start at the bottom of the list and build toward the ones that surprised me most. 9 proton pump inhibitors. Omeprazole, esomeprazole, pantoprazole, lansoprazole. These are the famous acid blockers for reflux, heartburn, and ulcer prevention. Tens of millions of older adults take them every day, often for years, sometimes decades, and they are considered so safe they are now sold in grocery stores. But recent, large-scale studies, including a nationwide Danish cohort published in Alzheimer's and Dementia and a U.S. study in the journal Neurology, have found that long-term cumulative use of PPIs has been associated with a noticeably higher rate of dementia. The mechanism is still being investigated, but we believe these drugs may deplete magnesium, may alter the gut microbiome, and may reduce the breakdown of amyloid protein in the brain. If you have been on a PPI for more than a year or 2, please ask your doctor whether you still need it, and whether you can step down to the lowest effective dose or try an H2 blocker instead. 8 long-acting benzodiazepines. These are the classic anxiety pills like diazepam, or the older sleeping pills. They are still prescribed for short-term panic, muscle spasm, and severe insomnia. A 2018 meta-analysis in the medical literature found that benzodiazepines with a long half-life, the kind that stay in your bloodstream all day, were associated with the highest dementia risk, in some studies close to double that of non-users. The mechanism is heartbreaking in its simplicity. These drugs amplify the effect of GABA, your brain's main calming chemical. Sit on those same receptors for years and your brain quietly down-regulates its own calming system. Memory consolidation is the first thing that suffers. If you are still using one of these daily, please do not stop abruptly, because withdrawal can be dangerous, but please bring it up at your next visit and ask whether a slower taper or a behavioral alternative might be right. 7. The Z-drug sleeping pills, zolpidem, zopiclone, esopiclone. These were marketed as the safer, more modern alternative to benzodiazepines for insomnia. And for short-term use, they can be very helpful. But long-running observational studies, including work published in major sleep journals, have raised real concerns about cumulative cognitive effects, especially in adults over 65. The American Geriatric Society has historically placed zolpidem on its Beers list of medications that older adults should generally avoid. The issue is not that these drugs are evil. The issue is that the brain cleanses and consolidates memories during deep sleep, and Z-drugs can subtly flatten that architecture. Please treat them as a brief bridge, not as a nightly companion. 6. Tricyclic antidepressants, amitriptyline, nortriptyline, doxepin, imipramine. Many of these have been used for depression, for chronic nerve pain, for migraine prevention, and even for sleep. But they carry a very heavy anticholinergic burden. The Anticholinergic Cognitive Burden Scale, called the ACB score, gives many TCAS the highest score of 3, meaning these drugs substantially block acetylcholine, the very chemical your memory circuits rely on. A landmark nested case control study by Coupland and colleagues, published in JAMA Internal Medicine in 2019, found that adults with high total anticholinergic exposure over a 10-year period had nearly 50% higher odds of developing dementia. TCAS were significant contributors to that exposure. If you are on one of these for nerve pain or for sleep, talk to your doctor about whether Ansari, or a non-anticholinergic alternative might serve you just as well. 5. Overactive bladder anticholinergics, oxybutynin, tolterodine, solifenacin, darafenacin. Millions of women and many men take these every day for the embarrassing and frustrating symptoms of an overactive bladder. They work well. They also cross the blood-brain barrier and block acetylcholine in exactly the regions that govern memory. A 2024 study in BMJ Medicine specifically looked at individual OAB medications and found oxybutynin, solifenacin, and tolterodine to be most strongly associated with dementia risk. The good news is the field is changing. Newer beta-3 agonists like mirabegron work through a completely different pathway and do not burden the brain. If bladder urgency is interfering with your life, please ask whether you might be a candidate for one of these alternatives. 4. Atypical antipsychotics, quetiapine, risperidone, olanzapine, aripiprazole. These are widely used for severe insomnia, for anxiety, for behavioral symptoms in dementia, and for psychotic depression. A 2024 BMJ study found antipsychotic use in dementia patients was associated with higher risks of stroke, blood clots, heart attack, and death. For people without dementia, chronic exposure still carries metabolic burden, sedation, and emerging concerns about long-term cognitive trajectory. When used in a fragile older adult, the trade-off must be very, very carefully weighed. 3. Paroxetine and anticholinergics risks. Paroxetine is the once-re that has a meaningful anticholinergic load. Many older adults are on paroxetine or have been in the past, sometimes for years. Other SRIs like sertraline, citalopram, and escitalopram are far more brain-friendly. If your mood has felt stable on paroxetine and you worry about switching, that is a reasonable conversation to have, but it is a conversation worth having. A 2023 study on antidepressants in older adults confirmed what we suspected, that anticholinergic antidepressants stand out in dementia risk. 2. Gabapentinoids. Gabapentin and pregabalin have exploded in popularity for nerve pain, restless legs, anxiety, and sleep. They are often called safe, and for short-term use, they usually are. But recent pharmacovigilance reports, along with growing real-world data, raise a real concern that chronic gabapentinoid exposure in older adults has been associated with cognitive fog, memory complaints, and balance problems. The drug dampens a neurotransmitter that your hippocampus uses to encode new memories. If you have been on gabapentin for a year or more and feel your thinking is fuzzier than it used to be, please raise that explicitly. And now the one I really want you to remember. 1. First-generation anticholinergic antihistamines, diphenhydramine, doxylamine, chlorpheniramine, hydroxyne. These are the Benadryl, the Tylenol PM, the Advil PM, the old sleep aid that your mother-in-law swears by, the motion sickness pill, the nighttime allergy tablet. They are everywhere. They are sold over the counter. They are in combination cold and sleep products. And they have one of the highest anticholinergic burdens of any drug class ever studied. Gray and colleagues, in their influential 2015 JAMA Internal Medicine study, found that higher cumulative use of strong anticholinergics, with first-generation antihistamines named specifically, was associated with an increased risk for dementia. The mechanism is the most important to understand. Acetylcholine is the neurotransmitter your brain uses to focus, to form memories, to pay attention. Imagine a memory synapse as a tiny lighthouse. Acetylcholine powers that lighthouse. Anticholinergics dim it, again and again, night After night, over years, this may accelerate the very processes we are trying to prevent. If you use one of these to sleep, please switch to a non-pharmacological routine like a consistent bedtime, dim lights an hour before bed, avoid screens, and use second-generation antihistamines like loratadine or cetirizine for allergies, because they do not cross into the brain. Before we close, I want to be very clear on three things. First, I am not warning you away from medicine. I am warning you toward wiser medicine. Second, every medication on this list has a legitimate use. The dose, the duration, and the individual matter. Third, never stop any of these drugs on your own. Withdrawal from benzodiazepines can cause seizures. Stopping a TCA abruptly can crash your mood. Stopping a PPI suddenly can cause a painful acid rebound. Talk to your prescriber, tell them you watched this video, and ask whether a deprescribing review might lighten your daily burden. Real cognitive resilience in your 60s, 70s, 80s, and beyond comes from many small things layered consistently. Walking 30 minutes a day, sleeping 7 hours, eating colorful plants, keeping your blood pressure controlled, staying socially engaged, protecting your hearing, challenging your mind, and yes, being honest about what is in your medicine cabinet. If this video helped you, please like it, share it with someone you love, and subscribe for more honest, calm conversations about the second half of life. Drop a comment below with your age, your country, and which of these medications surprised you the most. I read every one of them, and if you want a deeper dive on the anticholinergic, burden scale, on how to talk to your doctor about deprescribing, or on the 9 habits that protect memory after 70, look at the playlist on the screen. Take care of your brain. It has taken care of you for a very long time.